In this video, I want to briefly outline the difference between physiotherapists, osteopaths, and chiropractors so that you can make a better decision about which one may be best for your back pain. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of other people, perhaps like yourself, who also suffer from back pain. The advice I give is a mixture of my personal experience and professional advice, and I focus on giving advice that I wish I had known when I was suffering from back pain. So in this video, I want to shed some light on the different types of therapists you might go and see if you're suffering from back pain. So as you're probably aware, there are lots of people out there who are willing and able to give you advice and care if you are suffering from back pain. In my experience, people can get a bit lost and confused as to choosing who might be best for them. So today I want to focus on the three main types of therapists that you might choose if you're suffering from back pain: physiotherapists, osteopaths, and chiropractors. So just to get the ball rolling, I have absolutely no interest in turning this video into a ranking system between the different therapists or to try and convince you that one type of therapist is much better than the other. The truth is, I don't believe that any one type of therapist is better than the other. And I've seen all different types get fantastic results from their patients. So if you're interested in having that fight, I tap out. That type of conversation isn't particularly interesting to me. I simply want to use this video to give my opinion about the differing approaches that these therapists offer so that you can make a better decision regarding your care. So in my opinion, all good therapists who treat back pain will offer a mix of three different factors. The first is some sort of manual therapy. These are things like massage, popping and clicking, cupping, acupuncture, some sort of hands-on treatment. The second element is some sort of education and advice, and this might involve a whole host of things, but might include things like advice on pain education, how to better manage your pain. It might involve education about the anatomy involved, the specific part of your body that's being affected and how. It might involve things like how to manage stress and anxiety related to your current condition, or perhaps more practical things, changes in footwear, changes in your workstation, practical advice you can follow, all to help better manage your condition. And then finally, they'll offer some sort of exercise prescription. So this might involve changes to a current exercise routine that you're doing to help better manage your condition, or it may involve some sort of homework, which will be exercises that the therapist gives you to take home that will help you improve your particular back pain condition. So in terms of the differences between the three differing types of practitioners, physios, osteos, and chiros, I think the first most important point to note is that in my experience, they are more the same than they are different. And most good practitioners will offer some mix of those three elements of care, but normally in slightly differing proportions. On that note, I think it can be quite valuable to think of the different practitioners on a sort of spectrum from most manual therapy based on one end of the spectrum to most exercise based on the other end of the spectrum. So to start with my people, physiotherapists, yes, we will offer various types of manual therapy treatments, things like various types of stretching, massage, acupuncture, and things like that. But the truth is, modern physiotherapy practice has moved away from a heavier reliance on manual therapy treatments, more to a self-management, exercise, and advice-focused practice. So I often say that the tagline of physiotherapy is, "We treat disease through physical movement." And I think that really highlights the reality that although we will use manual therapy techniques, particularly when we want to get people out of acute cases of pain, we really are focused on helping people self-manage their conditions long-term through the advice we give and the exercises we offer. In my opinion, chiropractors tend to sit on the opposite end of that spectrum. And in my experience, when people see chiropractors, they tend to receive a lot more manual therapy style techniques. And in fact, chiropractors have techniques in their manual therapy repertoire that physiotherapists and osteopaths simply don't perform. So if you're someone who finds a lot of relief in hands-on manual therapy treatment, having something done to you, then this sort of approach may be quite appealing to you. So last but certainly not least, in my opinion, osteopaths tend to fall somewhere in the middle of that spectrum, and certainly in my experience, most osteopaths tend to have more finely developed and tuned manual therapy and palpation skills than the majority of physiotherapists, but they might be less attuned or less interested in the exercise prescription side of the equation. I've also noticed, now having worked with osteopaths for a while, that they do tend to place quite a strong and valuable focus on the education and advice element of care, which is, in my opinion, really good for allowing patients to help better self-manage their condition. I also noticed on the manual therapy side of things that most osteopaths tend to take a slightly gentler approach to techniques. So think more soft tissue work and gentle mobilizations rather than clicking and popping joints into place. Just to emphasize the point for clarity, we could expand our scope of practitioners to include personal trainers on one end of the spectrum and massage therapists on the opposite end of the spectrum. Of course, both of these professions can offer some assistance to people suffering from back pain. So with personal trainers, you may get a little bit of education and advice, and they may do a bit of what might look like manual therapy, various types of assisted stretching and so forth. But basically what they're giving you is majority or almost entirely exercise-based. On the opposite side of the spectrum, massage therapists, they may give you a little bit of education and advice, very little by way of exercise, and what they're offering is basically entirely manual therapy based. So by broadening the scope of practitioners we look at, it can really help us to understand the full spectrum of treatment offered by, let's call them, practitioners in musculoskeletal care. Now, of course, that's just a very broad and general overview, and it's worth noting that there can be very significant variance in treatment approach inter-clinician or inter-therapist. I certainly hope I haven't offended anyone or wildly mischaracterized the treatment approach of any one group of therapists. And in fact, if you are a patient or therapist watching this, please comment below. I'd be very interested in hearing whether or not my interpretation of the varying approaches of different therapists is consistent with yours. I suppose it's worth highlighting why I happen to choose studying physiotherapy over one of the other two therapy practices. The main reason for this is that I've always been very interested in the transformative power of exercise in increasing overall health. I also find that offering exercises is an extremely valuable way of empowering patients to take control and move forward with being able to manage their condition themselves. Now, I truly believe that people are very good at making appropriate decisions about their own healthcare when given good information. So if I could offer just one piece of advice in this context, it would be that you would probably be best off to seek out a therapist that is, at least in some part, what I would call a hybrid practitioner. That is to say, you're probably best off finding a practitioner who touches on all three elements of care: manual therapy, education and advice, and exercise, at least in some respect. So for example, if you go see a physiotherapist who just gives you a sheet of printed exercises and tells you to go home and do them, or perhaps you see a chiropractor who clicks and pops your back but gives you nothing by way of education and advice to help you manage your condition yourself, or perhaps you see an osteopath who gives you some lovely manual therapy and maybe some education and advice, but nothing with regards to exercises to help you improve your condition, that's all fine and is likely to help, and there may be some circumstances where that sort of thing is entirely appropriate. However, in my opinion, the best results tend to come when the therapist offers some combination of all three elements of care. When this happens, the three elements of care do tend to work together synergistically to help you, the patient, get the best results and move towards your goals more quickly and more efficiently. So, physio, osteo, chiro, which is best? Of course, the end result is going to be a personal decision based on what elements of care you happen to value as a patient. The main takeaway point from today is I hope that the different types of therapists are more similar than they are different and are simply using similar tools to work towards the same goal. I hope that after watching this video, you have just a little bit more information to help you make the best decision for you. I hope you found that information valuable. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed that video, please give it a thumbs up and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your journey to recovery. Thanks again for watching, and I'll see you in the next video.